In my previous video, I mentioned thyroid testing such as TSH, free and total T3, free and total T4, thyroglobulin antibodies, and thyroid peroxidase antibodies. So what are these tests and why should you have them tested? Let's get into it. I'm Nurse Vindira with By Individual Health and Wellness, and I'm a board-certified functional nurse health coach. So, what is TSH? Thyroid stimulating hormone, or TSH, is a hormone produced and released from the pituitary gland in the brain. The pituitary gland's release of TSH is controlled by the release of the thyrotropin-releasing hormone, TRH, that is produced by the hypothalamus in the brain. This is known as a hypothalamic pituitary thyroid feedback system. So, when the thyroid gland is stimulated, it produces and releases T4 and T3 hormones. T4 and T3 can be free or protein bound, and only the free T3 and T4 can enter the target cells and produce its effects. It's also important to note that T4 converts into T3, which is the active form, when it is needed. And there is an abundance of T4, 93% in circulation, compared to 7% of T3, which is in circulation. So what to take away from that is that the thyroid gland releases T4 and T3 hormones, and so you'd want to get those tested along with your TSH levels. If you have low T3 and T4 levels, TSH will be high, and if you have high levels of T3 and T4, TSH will be low. Now, if you're experiencing certain symptoms and your TSH levels are normal, you should have thyroid antibodies tested. These antibodies are the thyroglobulin antibodies and thyroid peroxidase antibodies. So even with a normal TSH level, antibodies can be present. So when you're going to get lab work done, be sure to advocate for yourself and ask and double check that your provider is ordering TSH, free and total T4, free and total T3, thyroglobulin antibodies, and thyroid peroxidase antibodies. Now, there is a reverse T3 test that you can also ask for. Reverse T3 basically is the brakes, and it blocks T3 from functioning. And remember, T3 is the active form. So these are all important tests to advocate for so you can understand your thyroid health and have a baseline so that way you can see and identify patterns early on. I hope you enjoyed this video, and be sure to like and subscribe, and I'll see you in the next one. Thank you and take care.